Child abuse and neglect are pressing issues that impact the safety, well-being, and future of children across the world. As early childhood providers, professionals are in a unique position to help prevent abuse, recognize the signs, and take action to protect vulnerable children. The daily interactions between providers and children create opportunities to detect early warning signs and intervene before the situation worsens. Furthermore, child care programs and early education centers can establish environments that not only respond to abuse but proactively prevent it. This video delves into the critical role of early childhood providers in preventing child abuse and neglect, outlining key strategies to ensure the safety and protection of children in early learning environments. These strategies include active supervision, creating a culture of protection, developing clear policies and procedures, training staff, and building strong relationships with families. Additionally, the video covers how early childhood providers can recognize signs of abuse and how to handle difficult situations, including what to do when a child discloses abuse. The importance of abuse prevention in early childhood. Preventing child abuse in early childhood settings is essential because these environments are often where young children spend a significant portion of their time outside their homes. Early childhood providers have the opportunity to observe children over extended periods, making them well-positioned to notice any changes in behavior or physical appearance that could indicate abuse or neglect. Moreover, early childhood centers can serve as a buffer for children who may be experiencing abuse at home, offering them a safe and nurturing space where they feel valued and protected. Unfortunately, child abuse and neglect have long-term consequences. Children who suffer from abuse are at risk of developing emotional, behavioral, and cognitive issues that can persist into adulthood. These effects include mental health problems like anxiety, depression, post-traumatic stress disorder, PTSD, difficulties forming healthy relationships, and academic struggles. In severe cases, the trauma caused by abuse can result in lifelong physical disabilities or even death. Early intervention is key to breaking the cycle of abuse. When abuse is recognized early and the proper steps are taken, children can receive the protection and support they need to heal. Early childhood providers, therefore, play a critical role not only in responding to abuse but also in preventing it by creating an environment where abuse is less likely to occur. Creating a culture of protection. A culture of protection within an early childhood program prioritizes the safety and well-being of children above all else. In such a culture, every staff member, volunteer, and family understands the importance of safeguarding children from harm. Creating a culture of protection requires clear communication, strong policies, and a commitment to vigilance. Establishing core values. The foundation of a protective culture is rooted in the program's core values. These values should emphasize respect, care, and safety for all children. Staff should model these values in their interactions with children, showing kindness, patience, and understanding in all situations. Creating a positive and nurturing environment makes children feel valued and reduces the risk of harm. Zero tolerance for abuse. A zero-tolerance policy for any form of abuse, whether physical, emotional, sexual, or neglectful, must be at the heart of every child care program. This policy should be clearly communicated to staff, families, and volunteers. Everyone involved in the program must understand that abusive behavior will not be tolerated under any circumstances and that any suspicion of abuse will be reported to the proper authorities immediately. Encouraging open communication. For a culture of protection to be effective, staff and families must feel empowered to speak up if they have concerns about a child's well-being. Open communication ensures that suspicions of abuse are not ignored or brushed aside. Staff should be trained to recognize when something seems off with a child, and families should be encouraged to report any stressors or difficulties they are experiencing at home. When communication channels are open, it becomes easier to identify potential risks and intervene early. Implementing active supervision. One of the most effective ways to prevent abuse in early childhood settings is through active supervision. Active supervision involves staying vigilant and responsive to children's needs at all times, ensuring that they are safe from both harm and dangerous situations. Maintain appropriate ratios. Maintaining proper staff-to-child ratios is a fundamental component of active supervision. When ratios are too high, staff members may become overwhelmed, leading to lapses in supervision. Lower ratios allow staff to focus on each child, providing individualized attention and ensuring that children are not left unsupervised in vulnerable situations. This is especially important in high-risk areas such as playgrounds, restrooms, or napping spaces. Positioning for optimal observation. Active supervision also requires strategic positioning of staff members within the classroom or play area. Staff should place themselves in locations that allow them to observe all children at once. For instance, staff members should avoid standing with their backs to a group of children or spending too much time focused on one activity while neglecting other parts of the room. Supervisors should also ensure that there are no blind spots in areas where children play or learn. Engaging with children. Active supervision is not just about watching children from a distance, it also involves engaging with them. By interacting with children during their activities, staff can better understand their emotional and physical state, making it easier to spot potential issues. Engaging with children allows staff to build trust and rapport, encouraging children to come forward if they are feeling uncomfortable or unsafe. Developing clear policies and procedures. A crucial aspect of abuse prevention in early childhood settings is the development of clear policies and procedures that outline how staff should handle various situations. These policies ensure consistency in how staff approach discipline, physical contact, and interactions with children. Staff conduct and behavior policies. One of the most important policies to implement is a code of conduct for staff behavior. This code should clearly define what is considered acceptable and unacceptable behavior, particularly in relation to physical contact with children. For example, staff should be discouraged from being alone with a child in a private area, and all physical contact should be appropriate, such as high fives or gentle pats on the back. There should also be guidelines on how staff can address challenging behaviors in a way that is respectful and non-punitive. Reporting and response procedures. Clear reporting and response procedures are essential for ensuring that any suspicions of abuse or neglect are addressed promptly and appropriately. Staff should be trained to recognize the signs of abuse and understand the steps they must take to report their concerns to Child Protective Services, CPS, or law enforcement. Programs should also have protocols in place for responding to an allegation of abuse, including how to document observations, how to communicate with the child's family, and how to cooperate with an investigation. Safe recruitment practices. An often overlooked aspect of abuse prevention is ensuring that the right individuals are hired to work in the early childhood setting. Safe recruitment practices, such as conducting background checks, verifying references, and asking specific questions about child protection during interviews, can help screen for potential risks. It is crucial that all staff, volunteers, and even frequent visitors to the program undergo thorough screening to reduce the likelihood of abuse occurring. Training and professional development. Regular training and professional development for staff are crucial for maintaining a safe environment. Abuse prevention training should be part of the onboarding process for all new hires, and regular refresher courses should be provided for all staff members. Key areas of training should include recognizing the signs of abuse, how to report suspicions, active supervision techniques, and positive behavior management strategies. Supervision and behavior management training. Training staff on supervision techniques is critical for preventing both abuse and accidental harm. Training should cover how to effectively monitor children, maintain appropriate boundaries, and intervene in unsafe situations. Additionally, staff should be equipped with skills for managing challenging behaviors in a positive and constructive way, reducing the likelihood of frustration or inappropriate responses. Understanding child development. Staff should also receive training on child development, helping them to recognize typical behaviors for each age group. This knowledge allows staff to differentiate between normal developmental behaviors and signs of distress or abuse. For instance, while temper tantrums are common in toddlers, frequent, intense outbursts in an older child might signal an underlying issue. Building strong relationships with families. Developing strong, positive relationships with families is another important strategy for preventing abuse. When families feel connected to their child's care providers, they are more likely to seek help when faced with stress or challenges. Strong family relationships also help build trust, making it easier to address concerns before they escalate into abuse or neglect. Engaging families in the program. One way to foster these relationships is by encouraging family engagement in the program. Offering parent-teacher conferences, family workshops, and opportunities for volunteering helps parents feel involved in their child's education and care. It also provides a space for caregivers to share concerns or ask for support, which can prevent abuse by reducing stressors that contribute to abusive behavior. Offering resources and support. Many instances of abuse and neglect are linked to stressors such as financial difficulties, lack of support, or mental health issues. Providing families with resources, such as information about food assistance programs, counseling services, or parenting workshops, can help alleviate these stressors. Early childhood programs should offer families access to these resources and create a supportive, non-judgmental environment where families feel comfortable seeking help. Recognizing the signs of abuse and neglect while prevention strategies are critical, it is equally important for early childhood providers to recognize the signs of abuse and neglect when they occur. The four primary categories of child abuse are physical abuse, emotional abuse, sexual abuse, and neglect, and each type has distinct warning signs. Physical abuse. Signs of physical abuse may include unexplained injuries, such as bruises, burns, or fractures, especially in areas of the body that are not typically injured during normal play. Children who are physically abused may also exhibit fear of adults, flinch when touched, or provide inconsistent explanations for their injuries. Emotional abuse. Emotional abuse can be more difficult to detect but may manifest in the form of extreme behaviors, such as withdrawal, aggression, or anxiety. Children who are emotionally abused may show signs of low self-esteem, fear of making mistakes, or difficulty forming relationships with peers or caregivers. Sexual abuse. Signs of sexual abuse can include inappropriate sexual behavior or knowledge beyond the child's age, difficulty walking or sitting, or the presence of sexually transmitted infections, STIs. Children may also express discomfort around specific adults or avoid being left alone with certain individuals. Neglect. Neglect is the failure to provide for a child's basic needs, including food, shelter, medical care, and supervision. Signs of neglect may include poor hygiene, malnutrition, frequent absences from school, or untreated medical conditions. Responding to disclosures of abuse. If a child discloses abuse, it is essential to respond calmly and with sensitivity. The adult should provide reassurance and support without asking probing questions or expressing shock or disbelief. The next step is to report the disclosure to CPS or law enforcement immediately. Early childhood providers must understand that their role is to report, not investigate, and leave the investigation to trained professionals. Conclusion. Preventing child abuse and neglect in early childhood settings requires a comprehensive approach that involves active supervision, clear policies, strong relationships with families, and ongoing staff training. Early childhood providers are in a unique position to protect children from harm and ensure their safety and well-being. By creating a culture of protection, recognizing the signs of abuse, and responding appropriately to concerns, early childhood providers can help prevent abuse and contribute to a brighter, safer future for the children in their care.